the standard of care and state-of-the-art medicine can be like 15 years in terms of by the time that the research coming out of Stanford hits the suburbs of Lubbock, Texas, or it can be 15 years. And so to democratize that and give that level of care now to everyone is super compelling. The thing that actually stood out to me, to your point on that user experience of building this longitudinal graph, was when Lotus grabbed all of my blood work from my annual exams over X number of years, and then could actually put a bunch of AI analysts to look at it and reach conclusions that no primary care doctor office that I've ever been to is going to take the time to actually take those disparate sources and records and try and actually make heads or tails of it. So it seems pretty compelling. The other thing that I guess I'm curious, because you have patients in the beta, and the thing that stood out to me in some of the stories you've told me were, we've never really seen what primary care looks like when you have 24/7 accessibility, the ability for that doctor to follow up with you sort of like every minute, every hour, every day, combined with sort of infinite patience. Like if I want to talk to the AI for 90 minutes, it's not trying to move to the next meeting. Maybe share a little more of what you've seen in the beta, because I do think that you're not just taking the current primary care experience, and putting it in an agent. It's actually changing behavior.
Absolutely. Yeah. I think, like I said, healthcare has been a user experience problem, but what that ends up sort of like, the consequence of that is like an outcome problem, an engagement problem, a patient engagement problem, right? Because the friction is so high, people just sort of avoid care. Right. And they just sort of like push it downstream until they get really sick, and now they have to go to the ER. Right. And that's actually a big part of the problem in healthcare today is our ER system and our hospital systems are overburdened and overwhelmed with patients that should have been treated and oftentimes prevented at primary care. Right. But because primary care hasn't really lived up to its promise, to your point, there's a huge gap between like what the sort of frontier of like research is showing in terms of what is sort of necessary to sort of prevent disease and what the actual delivery is and what the care access is in a lot of parts of the country, even in big cities like San Francisco or New York, like where you have institutions like UCSF. Even in those institutions, getting care in a timely manner outside of like emergent situations is pretty bad still, right? Even primary care within like larger systems is pretty bad. And the reason is actually it's a multidimensional problem, but the reason is the incentives are sort of misaligned, right? In the current system, doctors sort of bill 15 minutes of increments of time, right, to insurance companies to get reimbursed for their services. So by definition, what ends up happening, to your point, is there's no way a doctor is going to sit with you for 3 hours and really understand your problems and like try to help you holistically as a human. So what ends up happening is you go to this 15-minute appointment and they want to quickly figure out what's your one chief complaint, because that's how they bill insurance, and they want to get you out the door so they can see the next patient. And oftentimes that ends up being disconnected care that's not sort of a result of like reasoning over your entire life worth of health data, and you end up getting some prescription, or you get thrown to the sharks, and now you got to schedule a follow-up with a specialist and sort of play the insurance games. And so people just kind of get lost in that and then end up just being like, what, this is terrible. Like I'd rather just like not get healthcare, right? So it's we're not just solving, like to your point, just that, like that part in itself is huge. So even if we can just solve that, it's like a massive opportunity. But like we're very confident we're going to solve that, and we have solved that for a lot of people. But to your point, it's really giving like concierge level medicine to the mass population, something that has never really been done before. Because again, like I said, the incentives have always been misaligned, right?
One of the things I think that has been interesting as we've talked about AI, but some people think about AI in healthcare just in terms of doing a ChatGPT search and sort of getting a query, but AI is also good at actually things related to calling, faxing, some of the agent stuff. So whether it's getting medical records or trying to get you an appointment, it does seem like you'll be able to help build the most comprehensive set of medical records in one place, because as painful as it is, agents can now do some of that for you.
Absolutely.
And it seems like the same thing will apply to helping you actually like get in front of some of the specialists.
Absolutely, yeah, and we're already like thinking of ways to plug back into the system in a way that we are net value add, right? We're pulling all this data, but we're also pushing a lot of valuable sort of like, diagnoses and SOAP notes and such back into the systems. And I think that, like, to your point, yeah, like faxes are still like the majority of the way people communicate in healthcare. And yeah, e-faxing is a thing, and AI agents can do that really well. Right, so those are things we're already thinking about in terms of how we automate a lot of those workflows. But like I said earlier, it's even if you don't do that and you just get the first two problems, which are getting all your data and then being able to give you care when you need it, like that's a majority of the problem in healthcare today.
Yeah.
And people don't, like 100 million Americans don't have a primary care doctor today.
Wow.
Right. So even though we don't say that we're replacing your doctor, we kind of are their only doctor, right? Because they don't have any other alternative, right? So we become their first line of defense, right? And that's sort of enough for patients to be able to get the care that they need, so they can avoid having to go to ER in 3 months because they just ended up like abandoning or delaying that care altogether. I'll give you an example actually. So we recently finished our short scripts integration to be able to give prescriptions e-prescribe, right? So we can send you a prescription now in minutes to any pharmacy in the entire country. And that is a very hard thing to build, because even the integration into short scripts was like these 10 files of like PDFs of like pseudocode almost, like that we had to like read and figure out how to integrate into. And it typically takes about a year for anyone to integrate with them. And so when they were integrating with us, they were like, oh yeah, let's get the process started and let's check back in a month and then we'll do this. We're like, no, what are you guys talking about? Like, we need to do this next week. And then we got it done in a month. And their leadership team like reached out to us and they were like, this is the fastest we've ever seen anybody integrate. Like, what did you guys do? We were like, we just like did a lot of the hard engineering work that we would think like anybody would do.